Hi, I'm Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about some common questions about physical therapy and pain. So the first question that we're going to touch on is, how long will PT take? And of course, the short answer that you don't want to hear is, it can depend. But to delve into that a little bit deeper, tissue healing is where everything starts. And we know that on a cellular level, tissue healing can take about 6 to 8 weeks. So again, depending on the ailment or issue you're coming in for, if there is actually an injured tissue that needs to heal, we're probably looking at about 6 to 8 weeks. So for something like an ankle sprain, that's where I would start. Now, some of the other things that bring people to physical therapy could be due to more chronic issues, postural dysfunction, so bad habits in how you sit at your desk or something like that can lead to pain. And oftentimes, although you have created some inflammation or damage to local tissues, the issue there is really breaking a bad habit, and we all know breaking bad habits can take a long time. For those patients, what I will tell them is, in the beginning, once we get to the root cause of what led you to the pain that you're reporting, then we have to start breaking that habit. As quick as you can get that done, once we've done that, that's when the clock will start ticking on allowing the tissue healing piece to kick in. So from then, it could be 6 to 8 weeks. Other health issues can also slow down healing. So if you have diabetes, or if you are obese or are a smoker, those are known other medical conditions that can slow tissue healing times. So we certainly encourage that if you are a smoker, you stop smoking as soon as possible, because we do know that the minute you stop smoking, your body does start to heal and you get improved circulation, which can help heal those tissues. Also, in general, the sooner you handle an issue, the better. So, I have people who walk in my door and they're like, oh yes, I've had this back pain for 10 years and I'm going on this nice European vacation and I'm gonna do a lot of walking in 2 weeks. Can you fix my pain? And honestly, I'm gonna tell them, no. If you've had something going on for 10 years, you're probably falling into that category of needing to break some bad habits, and you've had some adaptive tissue changes that could lead to significant weakness in some areas and tightness in others. And that can take some time to improve. So one of the rules of thumb I tell my patients and family and friends is, if you do have pain and it's not improving within a week, I want you to seek care and help soon so that we can get it handled and get you back on track to recovery faster. The faster we can start to address something, the faster we can get you better. Another common question that I'm often asked is, should you use ice or heat? So again, depends a little bit on the situation. Generally speaking, for acute injuries, meaning they just happened, we are going to recommend ice for at least the first 48 to 72 hours. And the reason for that is, if there's an inflammatory process, we don't want more blood and more fluid pumping to an area. So if you use heat, how heat works is it is a vasodilator. What that means is that the blood vessels are actually getting larger, which allows for more blood flow and fluid to go to the area. And in those acute cases, your body can take some of that fluid and create more inflammation. So we don't want heat in the acute phases. We would prefer ice, which is a vasoconstrictor. The blood vessels are going to get smaller. Now again, as soon as you thaw out from using that ice, your blood vessels are going to go back to normal. It's not like we're causing any long-term changes, but it's just going to allow your body to not absorb more fluid and hopefully be able to eliminate some of it. If you have something that's more chronic, meaning it's going on at least 72 hours, but this could be up to 10 years ago, like I just used in my last example, heat can be a good option. Generally, if you're feeling tightness or stiffness, sometimes heat is good because it does bring more blood flow to the area, which can act as a lubricant to your muscles and to your joints. I'll often talk to patients who have arthritis and they might say, oh gosh, I wake up in the morning, or now that it's, if it's winter time and they're so cold, I wake up so stiff in the morning. And I joke around and I say, yeah, you kind of wake up like the Tin Man, and to help oil your joints, you can use heat. And there's different forms of heat. It doesn't necessarily mean it has to be a hot pack, but it could be, yes, it could be a hot water bottle. It could be an electric heating blanket or heating pad. It could just be a warm shower or a bath. All of those heating modalities have that same vasodilating effect. As for different types of ice, you can use direct ice cubes in those old school ice bags. What I do warn is, if you are using actual ice cubes, please make sure there's at least a layer of something thin between the ice and your skin. So a thin kitchen towel, or at least a paper towel, so you don't freeze or burn yourself. If it's too thick, like a beach towel, the cold won't get through. So when you are trying to ice a tissue, it needs to get pretty darn chilly to have the effect that we are looking for. When you are icing, we say a minimum of 10 minutes and no more than 20 at any given time. And once your skin thaws out to the touch, you could ice again. Ends up being about once an hour if necessary. With heat, usually we say up to, again, 20 minutes. Make sure it's not too hot that you're going to burn. And please don't fall asleep with electric blankets or heating modalities on you, because I do have people who burn themselves. Perfect. I think that covers our ice and heat question. And the last general question that we'll touch on today, what does posture have to do with pain? So posture can have a lot to do with pain. And if you've referenced several of our prior vlogs, posture can have an effect on all sorts of disorders. It can cause headaches. It can cause temporomandibular joint dysfunction or that jaw pain. It can just cause straight old good neck, shoulder, upper back, lower back pain. So it has a lot to do with how a person might be reporting pain and where that pain might be. And oftentimes posture is just a habit. So poor habits like slouching, rounding that upper back, or a forward head position can lead to tightness in some of the neck muscles. And also people who report pain in that upper back, if you're super slouchy, it's your back muscles screaming at you and trying to fire to pull you back up tall. It's almost like that they're overworked, they're tired of trying to lift you back up. The other big problem with posture is that most people don't know that they have poor posture, and knowledge is half the battle. If you don't know that you're in poor posture, then how are we going to go about fixing it? So oftentimes I will tell patients, once they've come in and I'm suspecting that this might be something that's causing the problem, I'll tell them to have a family member or a friend take a picture of them, on the couch or at their desk if they have a home desk workstation when they're not paying attention, and sometimes they're mortified at what they see. But you can then take that picture back into your physical therapist, and we can start to talk to you about strategies to improve your posture that hopefully don't mean buy a whole new workstation. We have some good tricks of the trade that we can pass along. In general, though, when it comes to posture, thinking alignment. So we don't want that head jutting out in front of us. If you think of kind of the hole in your ear, we want the whole of your ear lined up right over the tip of your shoulder, the little hip bumps on the side of your hips, down through the side of your knee and into your ankle bone if you're standing. Some related vlog topics that might be of interest to you would include how a warm healing laser improves PT results. Our class 4 laser is a modality that serves as a heating agent. So when I answered your questions about ice and heat, that could be an option for you. Also, another vlog using PT to get to the root cause of pain. Again, we have to investigate why posture might be causing your pain. And if we don't do that full assessment to figure that out, we might not get to the right answer, and we might just treat the pain, but it can return because we haven't figured out the root cause. Another vlog that I mentioned earlier that could be of assistance is how laser therapy can relieve TMJ pain. Again, posture can cause TMJ pain. And lastly, why PT is effective relief for shoulder pain. We hope you check those out soon. For more information, or if you'd like to set up a complimentary consultation or evaluation, please reach out to our front desk, and we hope to hear from you soon. Thank you.